It's been 3 days of intense work, and I think it surpassed the expectations we had. We had an initial plan about building a roadmap, but a lot more from the content came up, and it's because of the quality of the people that was participating.
The objectives that we have set up for this meeting is to come up with a set of actionable items that can help us achieve that goal, the goal that the Ministry of Health has put forward through the National Cancer Control Plan. We're all stakeholders, breast cancer stakeholders. Every one of us owns a little piece of that, and thus we have a responsibility also to work towards that goal.
Strategic thinking is very taxing and very stressful, but the way it has been done so smoothly. Yeah? You think like you're just playing. We have got Legos, we have had crayons, we have had different color papers, but it brings out that creative aspect of you to think like, look, you don't need to really crack your head, you have all the answers and you can generate interventions just here.
But what has happened over the last 1 decade or so is that a number of publications in leading journals are now coming out telling us that mammography may not be the best screening modality for breast cancer for several reasons. Breast cancer is the leading cause of death from cancer in low and middle income countries among women. In many countries, it's the overall largest cause of cancer death too.
Screening for cancer should be integrated within existing facilities or services that occur already at primary healthcare level. Like we are already seeing integration of breast into cervical cancer and integration of cervical cancer into HIV services. We have prioritized 4 cancers: cervical, breast, prostate, and retinoblastoma.
If you look at this country, like over 80% of the workforce are nurses, and they are found even in places where there's no doctor. And these are the places where our cancer patients come from. So for me, looking at the success of the VIA program where nurses are screening, I think I would push for empowerment of nurses to be actively involved, not necessarily people working in an oncology setup, but using the people in the primary healthcare system.
We can't treat all breast cancers at the one oncology center we have in Zambia. So we really need to figure out a way, and that's what we're doing, I think, over these 3 days.
The objective to definitely find an action plan to reduce mortality from breast cancer. Achieving this objective was going to take time, but the construction of the action plan is there. So this is a very good start.
So we need to go out there. We need to break the barriers and penetrate through. Get hold of the rural population, because they're a really large part of our country, and that's going to help us in the fight against breast cancer.
We do have 2 strategic imperatives. One is that we really invest in scientific and medical research, because this is what really has brought breast cancer mortality down in the United States. So really, try to find treatments that are more effective, that are less toxic, and also what are the risk factors, what are the causes of breast cancer. These are key components of breast cancer control. So a lot of our investment goes on that side.
So this design thinking is also very good. This form of using human-centric thinking is excellent.
I think it's broadened my thinking, and being able to sit with a diverse group of people, share ideas, clarify what you're thinking and where you're going, I think has been an exciting journey. And also being able to create a vision for the good of the country and ultimately the women of Zambia, I think is awesome. I feel privileged to have been part of this group, because I've been working at the Cancer Diseases Hospital since 2008, and seeing a program that is targeting and reducing the burden of the disease, so that then we see less people coming in with advanced disease, and also cutting out the struggle of people having to come just to Lusaka. I think for me, the day this program is implemented will be the most awesome day for this country.